Good afternoon, and welcome to this panel of the Merge Conference. This panel is titled Investing in Equity-Based Solutions. It's my understanding that day one of the Merge Conference is really a macro view of issues. And so I just want to say that in that vein, we're only going to scratch the surface today on the issues we're going to talk about. We're going to take a macro view, and we hope that what you hear today may just whet your appetite. You may reach out to us, or you may investigate on your own how you might help to solve some of these issues that we're going to talk about. So, the disparities that we see in this country stem from racist laws and policies and governance schemes that are entrenched in racial segregation across a range of areas. And this session will focus particularly on the criminal justice system, on the fines and fees in the criminal justice system, and in the healthcare system, particularly on the health of Black women. And with that, I'm going to quickly turn to our panelists. We've got two expert panelists today, and I'm going to try to keep us on time. If you've got questions, please put them in the chat. I'm a fan of both of these ladies, and so I'm going to try to make sure I don't just become spectator mode and listen only. Now I'm going to try to moderate this and keep us on track. But I am Darrin Williams. I'm CEO of Southern Bancorp. We are a CDFI bank based in Arkansas and Mississippi, $2.2 billion in assets, about 54 locations across the rural delta of Arkansas and Mississippi. Joining us also is Linda Goler Blount. She's president and CEO of Black Women's Health Imperative, as well as Priya Sarathy Jones, who's the National Policy and Campaigns Director for Fines and Fees Justice Center. So with that, I'm going to turn it over to Linda first, and then Priya, and have you tell us about your organization and your work and your role there quickly. Thank you.
Well, thank you so much, Darrin, and it's great to be here and be a part of this Emerge conference and have this really important conversation. The Black Women's Health Imperative for almost 40 years has been the only national organization focused on the health and wellness of Black women, emotionally, physically, and financially, because we need all three in order to be healthy. And we started at when Billy Avery, our founder, brought 2,000 of our closest friends to Spelman's campus to talk about how we should not only take care of each other, but take care of ourselves. And so our work is focused on chronic disease prevention and risk reduction, HIV prevention, reproductive justice, not surprising, maternal health. And in the almost 8 years since I've been in this role, what I bring as an epidemiologist is research. And so from a policy perspective and research perspective, we've been examining the relationship between racism and gender discrimination and health. And what I think may be important for this conversation is a few years ago, we asked Black women to define health. We did a study and asked them, purely qualitative study. And what we found from talking to almost 5,000 Black women is that Black women define health in psychosocial terms and financial terms. They actually do not. It's not that chronic disease is not important, but they don't actually define their health in terms of disease state and physical health. So essentially what they were saying to us is, if I can get my mind right and my spirit right and my money right, I can take care of everything else. And so as they talk about their health, as we talk about the lived experiences of Black women, what comes up is how they feel and what does it mean to be a Black woman in this society, in this time, and do I have the resources to support me to be as healthy as I can. So I am looking forward to this conversation because these issues are all so closely connected. So thank you.
Thank you, Linda. Priya, a little bit about your organization and your work there.
Yeah, thank you. So FFJC is a national advocacy organization, and we're working to create a justice system that treats individuals fairly, ensures public safety and community prosperity, and is funded equitably. We work collaboratively with affected communities and justice system stakeholders to eliminate fees in the justice system and ensure that fines are equitably imposed, and try to end the abusive collection practices. Our work really stems out of the DOJ investigation into Ferguson, Missouri. And so while a lot of people are very familiar with the shooting of Michael Brown, there was an adjacent report to the shooting that was an investigation into the police practices in Ferguson. And what that investigation found was how the city of Ferguson used its practice of fines and fees to harm the community, right? How much they were extracting wealth from predominantly low income and Black neighborhoods in Ferguson, and what what we saw, so all of us who may not have been in Ferguson, was the tipping point of decades of practices that have been in place of charging people hundreds of dollars and citing them for jaywalking, issuing people multiple citations at a stop that had thousands of dollars of fines and fees attached to it, and using those fines and fees to fund their government, right? 20 to 30% of their budgets were coming from the pockets of the people who were most unable to carry that. And when people don't pay, they issued warrants and tried to arrest people in an attempt to get them to pay. So the way that we do our work is both on the state level and the national level. So we have state campaigns in 5 states, or 4 states right now. We'll be in a 5th state next year: Florida, New York, Nevada, and New Mexico. And in those 4 states, we work, all the fines and fees are set up differently in these states. So we work with legislators and with community groups to change the laws in these states to get us away from using these fines and fees the way that we are. And then on a national scope, we work in the other 46 states by working with advocates and community groups to do the same thing, to replicate our models, our understandings of these issues, and hopefully dismantle this system that's being used across the country.
Thank you for that. You both have really kind of hit directly on the issue of kind of how finances impact how women think about their health care and how it impacts folks who are engaged in the criminal justice system. The same structural inequalities that impact all systems in society obviously have come to play here. Talk a little bit about, first you, Linda, and then you, Priya, about kind of the connections between the communities you serve and those that have been historically disinvested in, been discriminated against, and structural problems, and what that means in the work that you do.
Okay, sure. So, and you really hit on it when you talk about disinvestment. I mean, there's been systemic disinvestment in Black and brown communities. When you look back, the point at which health disparities or health inequalities were at their narrowest, when financial inequalities were at their narrowest, was like the early 70s. Things have gotten worse in the last 50 years, despite all of the policies that we've heard about, that we've read about, that we've invested in. Money has been taken out of the Black and brown community. And we see that in premature mortality. We know that this systematic disinvestment and poverty is responsible for something like 90 to 100,000 premature deaths among Black people every single year. The tax code obviously works against Black and brown community. Just, I think it was the month before last, in March, Dorothy Brown was on the cover of Bloomberg Business Week talking about how the tax code works against the Black community. And when we think about healthcare, if we're less likely to have employer-based insurance, that means we're less likely to get healthcare coverage. And if you look at neighborhoods, New Orleans is a great example. You cut a highway completely through the community. You cut the community off from things like grocery stores and pharmacies, schools, a tax base that supports schools. Well, in areas of concentrated poverty, you're not going to have high quality schools, which then determines a child's career trajectory. And we know, you've all heard this saying that a child, if not reading at grade level, by 4th grade is more likely to go to jail than college. All of this affects their health. Red line districts are 13 degrees warmer in the summer than non-red line districts. And so we see higher maternal mortality rates in red line districts. So we've got to look at what we do around healthcare. COVID-19 was the example of examples. Where we got testing was not, you needed a car. If you didn't have a car, it was tough for you to get tested. Where are you going to get vaccinated? You need a car. If you don't have a car, and the way we collected data and reported data certainly did not include the Black and brown community. So, I'll sort of stop with one thought from the science, which is from David Williams. If we actually could eliminate neighborhood racial segregation, we would actually eliminate health disparities and income disparities. So there are some real systemic policy solutions that we could look at and examine, particularly from financial institutions. But as you know, it's going to take political will to make that happen.
Right, fascinating. That's really interesting stats. 13 degrees warmer in red line districts. For this group where there's so many financial institutions, I think there are real things we can talk about there because we are the ones who are not lending in those areas. So we'll circle back to that. Priya, talk a little bit from your perspective about the connections between this lack of investment particularly in Black and brown communities and what that means in the work that you're doing and who do you see showing up in folks you're serving?
Yeah, so our work directly is targeted towards low income communities that are predominantly Black and brown, right? And so this isn't tends not to be surprising to individuals for many of the reasons that Linda just said. Like, these are communities that have been historically disinvested in, right? And all of the other ways that are outside of the criminal justice system, education, opportunities, jobs, real estate development, stores, retail, I mean, and medical services, in every way that you can think of. These have been communities that have not been invested in and actually divested in. And then on the other side of that, what you have is a criminal justice system, right? So when you've taken out all of these investments, when you've not done sort of all the work that goes into building healthy communities, what you end up with, the consequence of that is criminal justice systems. That's not the starting point of any of this. This is how we have tried to deal with the lack of investment on this side. And the fines and fees issue in particular has come up as a financial solutions for city and local and state governments when they are not able to generate revenue in the traditional ways that we think about revenue generation, taxes, primarily taxes, like the variety of ways that you can tax and use state and local taxes to fund your government. When we can't come up with positive solutions that way, we come up with regressive taxing systems, and that is what fines and fees really are, and specifically fees. And so it's probably important to just, for this audience, know that fines are by definition the punishment. So when you talk about fines and fees, a fine is like $20 fine, $30 fine for the thing that you did wrong, whatever that might be. The fees have nothing to do with the punishment. The fees are all these things that we've added on to the back end of the fine to fund government. And those fees go everywhere. They go to pet projects, they go to criminal justice systems, they go to healthcare, they go to all the ways that the government hasn't been adequately generating revenue to fund their systems. And what the way we're going about that now is asking individuals to do that through the form of citation, our criminal justice system. It's not just to pay for the system, which arguably isn't even the right way to pay for the system. These things go to things that have nothing to do with the system. So that's really how this is showing up. And so what ends up happening is we're asking those who can afford it the least, those who are already dealing with the things that Linda mentioned, healthcare inequities or job employment inequities. And right now, all the inequities that stem from COVID-19, they're already in those communities. And then we're saying, well, too bad, also pay for everything else, right? We're going to charge you for all of these things. And so it's really hard actually to look at a community and just try to piece out fines or fees, piece out healthcare, piece out education, because all of these things are working in tandem to like depress these communities even more. And so we have to look at the entire thing. And it's really in so many ways not that complicated. You know what it takes to make a healthy community. We see this in predominantly white and higher income neighborhoods across the country. It isn't that much rocket science. You need the same things in these communities that have long been overlooked. And actually at this point, you need to overinvest in those communities that have long been underinvested in. If we are really going to try to find any equality, then that is really what equity is. You have to give more to those we've given less to for so long if we want any chance at trying to balance these scales out.
That's a great segue into a question from the audience. Really, is what this is an audience of financial institutions, right? This is the Financial Health Network. A lot of folks in this audience and the part of the Financial Health Network are fintechs. So the question is on these issues, these problems we talked about today, what can fintech do? Clearly, there's a role for financial institutions like banks like ours who have redlined those communities, unfortunately. But now fintechs are kind of that's the new thing. We're bringing technology to bear on this. What can fintechs do to help solve some of the issues? And Linda, I'll start with you.
Okay. Yeah, that's a great question. What came up in terms of technology last year was telehealth, because people were not going to the doctor's offices. And it on its face, it seems like a great idea. And when you think about fintech, there could be a great opportunity to put banking in the hands of folks. And I've seen several ads for apps. But there's a couple of things. One is who can afford the technology. In telehealth, if you didn't have broadband access, you couldn't have a video health meeting with your provider. You could do it over the phone, but it's not quite the same. And the same is true, I think, with financial services. You've got to have a certain amount of money for those apps to really do much for you. And so, from a technology perspective, I think, from fintech, there could be, to Priya's point, an investment in the community infrastructure. what does it take to make sure that people can have what they need in their hands or, on their desktops to make the best financial decisions that work for them, not just here's a nice shiny new app, but let's invest in the infrastructure and then bring it down to an education level. What are we doing from a fintech perspective for kids? I mean, there's an app now for children. That's lovely, but I'm going to guess the average low income family does not have that app for their child. So how do we build financial sort of literacy, although I'm not so fond of that term, in young kids and their families? But that means dealing with the public school education system. And that's certainly an opportunity for fintech. But I would also say that, I think there's also an opportunity to Priya's point, because, her point is shocking that municipalities fund themselves on the backs of poor people. I think there's certainly an opportunity for the financial technology world to say, hey, wait a minute, this makes no sense. Let's completely reimagine how we're looking at fines and fees, how we're assessing, who we're assessing. Let's look at the data to see, of the upper income people who have fines, what percentage of them actually pay those fines versus those who just get out of them entirely, which I think we probably have some estimate about. I think there's a real role for fintech to play in community infrastructure and changing these policies and procedures that are so punitive to low income people and Black and brown people.
Thank you, Linda. Priya, same question for you.
Yeah, so, the criminal justice system, in particular, when we're talking about criminal justice debt, like the way that I'm viewing this is that there's a parallel financial system to the one that we're used to, the one that maybe this audience is most familiar with, and that's the criminal justice debt system, right? So we recently released a report where we were able to get very partial data from partial states. So about 14 states we could get the full amount of data, about 11 or 13 states we got partial data. So roughly around half of the states we have some data. And we were able to conclude from that there is at least $26.1 billion in criminal justice debt in this country. And the problem is we don't actually know. We don't know how much debt is out there. We don't know who exactly it's owed to. We don't know exactly what it's for. And, I know in the financial system, when you're issuing loans, when you're thinking about someone's ability to pay you back, right? When you're making these investments, you underwrite these loans. You think about, can they actually take this debt on, pay it back without hardship, without risk, and, profitable to the company. From the criminal justice system, there's no underwriting. We look at a person, we've determined you've done something so wrong, we assign a financial penalty to that without really taking anything into consideration, and then we punish you when you inevitably do the thing that you're set up to do, which is not pay it, right? Which is not have the ability to pay it. And a lot of this debt falls into people who have been incarcerated. So we already know the challenges with employment and opportunities when people have been incarcerated, and somehow we expect them to pay back the debts, right? And when they don't, we punish them. So when I think about where the opportunities in this space may lie, one, I don't think that it is good for our financial institutions to have a separate financial system that is creating debt and to the same people you're seeking to support, right? That you don't even understand that debt is out there. You're probably not even asking about it from people when you're trying to figure out what you can do for them. You probably don't even know that it's there, right? And so if you don't know it's there, you don't even know how to solve for it. So there's that piece. I think knowing and figuring out from the people you're trying to serve on one side, how you also pull this criminal justice debt into this larger financial picture and this financial debt situation. When you think about state, local governments, one of the most surprising and interesting things from finance that came up with the Ferguson issue was their Moody's rating for issuing bonds for their city, right? It was based not largely, but a significant portion of how they looked at the investment there and the rating had to do on the reliance of fines and fees, which is not stable, which is punitive, which is problematic and unreliable because you're not even collecting on these debts. And when this investigation happened and they saw that, their ratings went from AAA to like a D, right? So really looking at how are city governments relying on fines and fees, and are these secure bonds, given that this is actually what they are relying on to pay you back for the issuance of fines? And what is the power from the finance community in knowing that? And getting the city and state and local governments to get away from relying on them in their financial planning. So that's that piece. And once we can actually deal with policies that eliminate fees, so we're not generating revenue or financing government through this, we're squarely in the space of what does an equitable fine look like? What should a fine be? And is it individualized to both the person and the offense? Then you can really look at technology. And what is the technology we're going to do to determine that this individual's appropriate fine? How can we do that easier? How can we look at technology? Because that's something we hear from judges in the court system is there's a willingness to look at this in such an individual way, but you have to make that easy. You have to make it easy, but you also have to make it individualized in such a way that you're not just like saying, oh, you should be able to pay this $100. Actually, this app tells me that you should only be able to pay $10, and that's what your fine is. And everyone should walk away, and there should be a payment plan, and we should make that easy, and you should get notifications, and we can add all this useful technologies and systems that we think work on that space.
Thank you. Wow, both of you. I told you all. We're going to scratch the surface. There's either one of them could have taken a full hour, let alone 25 minutes together. But really interesting information here, and some stats that really stuck with me. $26 billion in debt, and that's just what we know. 90 to 100 premature deaths annually because of a lack of real access to financial health by Black women. Really, really interesting things. I hope this conversation really piqued your interest. I hope you will dig deeper, reach out to us, find ways that you might be able to help solve these issues, help at least work on these issues. A part of the Financial Health Network's group of people who of companies that work in the fintech space and the financial health space, they're just tremendous innovators. You guys are working on some really interesting things. And I think there's room for you in both of these areas. And I just would encourage you as you go through the conference and reflect back on what both Priya and Linda said, and think about ways that you might be able to bring your own solutions or help bring solutions to bear on these issues and these challenges. And with that, we're out of time. I wish we had more time. Priya, thank you so much. Linda, thank you so much. Really appreciate all you had to share with us today. Thank you.
Thank you.